Hello everybody, welcome to another edition of Doctor's Orders. Some of you may have expected to see me live on ICRA Television, Sky Channel 742. Unfortunately, this show had to be postponed because of the current coronavirus crisis. However, instead, I'm going to do a special Doctor's Orders episode addressing questions sent to me. So let me introduce myself. My name is Dr Asim Farooq. I'm an NHS and private GP in Croydon and Chelsea. I'm sometimes known to friends and family as the G or Dr Farquhar. Feel free to comment below if you have any further questions, and please, it would help me a lot if you subscribed and widely shared and liked this video until it becomes viral. First of all, some sad news. I'd like to announce the death today of a highly respected GP colleague of mine, Dr Krishnan Arora. May you rest in peace. It's very unfortunate. Many of my colleagues have died because of the coronavirus crisis. Perhaps they've not been given the right protective equipment. I salute you all, and remember to clap for the NHS today at 8 p.m. Also, I'd like to give a quick mention to @Million Meals UK, in which many restaurants, including locally Zen Lounge, Grand Sapphire and Spice Village, have come together in an initiative to feed key workers on the front line, including the NHS. They have to date provided 5,000 meals all across the country to hospitals and police stations. Some of the meals have even been delivered by David Beckham. So if you would like to contribute in any way, please visit the Million Meal Movement website. Do you think herd immunity is better than complete isolation until the virus disappears? Herd immunity, as some of you may or may not have heard about, is really only something that can be achieved with vaccination, where if you vaccinate enough people, then it will protect the others who haven't been vaccinated. This won't necessarily apply to a pandemic crisis, which also assumes that the vast majority of people who will get it will have no problems and will also recover and have immunity. But we haven't really established this yet. Also, using these models, it showed that large numbers of people would die as a result and the NHS would be overwhelmed. The UK did try doing this initially, and some have blamed the government for this delay. May have caused a lot of unavoidable deaths, which currently stands at 13,000. We know the USA has also currently got 29,000 deaths. Why have the UK and the USA been hit so severely with the mortalities due to COVID? Well, some of that may relate to the initial plan to do herd immunity, but we were hit with almost 1,000 deaths a day in the UK, which was even more than Italy. First of all, we have to understand that there is a case fatality ratio different to the mortality ratio, which is the number of people who actually were tested versus the number of people who died. So in that case, there have currently been 98,500 cases positive versus 12,800 deaths, which officially means it's a 13% case fatality ratio, but this is only the people who were tested. Obviously, the numbers will be less than that. But don't forget as well, there's some other figures that will make the difference. There's a time lag between deaths being recorded and registered. There's also the fact that in the UK, we have not included care home deaths. And as some of you may be seeing in the media, this is becoming more of an issue that we need to address. France, however, does include care home deaths in its figures. The Office of National Statistics say that the likely true figure of deaths is probably 20% higher than we are currently reporting. It's really important, if you need to know the true mortality rate in the country, we need to do more testing, which obviously we're woefully short on that at the moment. There may be reasons other than that why we've had higher deaths. As an example, Germany, much lower death rates. Maybe they've got more acute care beds, maybe because they went into a lockdown earlier. Maybe their population is different, and perhaps they were given more protective equipment, but we really don't know 100% why there's such a variation. How long do you think the lockdown will last? Well, some countries, for instance China, are beginning to return back to work, and then we'll really see what difference it makes, whether lockdown, which obviously has its own medical as well as mental health problems and financial problems, versus herd immunity, letting people get re-exposed to the virus, what will happen as a result. There is a real lack of evidence which is going to be the best policy, which is why there's been such a wide diversity of responses in different countries, example being Brazil, where there's been no lockdown at all. But we have a disease which we know is fatal, but we don't know exactly how fatal it is. We know it's very infectious, but again, how infectious? There is a lack of testing. We don't know for sure. What is the true fatality rate? Is it 5%? Is it 1%? Is it 0.3%? Therefore, how drastic should be our response as a result? Remember as well, the death rates are going to lag behind the actual deaths. And don't forget that deaths should not be confused with hospital deaths and total deaths. But for now, in the UK, we've extended our lockdown for another few weeks. So please follow the government advice about this. Is ibuprofen safe or not? I am confused.com. Well, this all started because the French health minister advised against using ibuprofen because he'd seen some reports of people developing a more severe illness, especially pneumonia, when they used ibuprofen. But remember, these were a few observations. They were not scientific studies. The World Health Organization decided to be cautious at first and recommended using paracetamol instead of ibuprofen. And certainly for adults, it does work better, reducing fever. But we also started seeing that people would come to me and say, I can't use ibuprofen at all, even people who didn't have any coronavirus symptoms. So this had its own problems. The World Health Organization, as well as the MHRA, have said that it is now safe to use either ibuprofen or paracetamol. There's no evidence that it causes harm. Now, it's important that you use the lowest dose possible. Everyone has their own individual risk factors for heart disease or gastric problems or kidney disease by using this. If you have been using it anyway for a long-term condition, there's no problems when using it. If you are unwell though, perhaps it's a good idea to use paracetamol first, but do not be afraid to use ibuprofen. Can the use of antihistamines for hay fever make you more susceptible to develop COVID-19? Simply put, there's no link at all with antihistamines causing you to have more susceptibility to COVID-19. However, do remember there are some similarity in some of the symptoms. For instance, you can get a runny nose, a cough, sneezing, and also you can be triggered an asthma attack if you have got hay fever in those cases. Don't also forget that hay fever will not cause any temperatures. So if you have got temperatures, don't just put this down to hay fever, but otherwise it's absolutely fine to use your antihistamines, your nasal sprays without any further problems. What medications and treatments are the latest clinical trials working on? When are they likely to be available? Now, I'm going to probably do another completely separate episode all about treatments and future treatments. But do remember that most people who become unwell with COVID will be able to recover at home without any further problems. And we don't really have any proven treatments that 100% work right now. But for now, if you feel unwell with the flu-like symptoms, it's really important that you get enough rest, that you stay well hydrated, you take medications that will relieve your fever, relieve your aches and pains, and all of this will help. Make sure you're eating well, you're well nourished. You can take general vitamins and minerals, not a problem at all. If you're well enough to do some basic exercises, that's all fine. But in the meantime, we're working very hard to develop some treatments. There are some which we can talk about next time. For instance, treatments we use for malaria, some we use for autoimmune disease, some antiviral drugs. All of these are currently being tested. We're also looking at antibodies from people who've recovered, in other words, their plasma. Can you catch it again if you've had it once? Do you think it will become a chronic viral infection like seasonal flu, which will need yearly vaccination? At the moment, we're not 100% sure. With most viruses, once you have them, including a lot of flus, then you will have antibodies, and that will protect you against that exact strain of virus for the next time. But what we don't know is, will this virus change? Will it mutate? Again, this is unknown. We also don't know whether the antibodies, do they stay for a long time and protect you or not. Regarding a vaccine, it is in development. We are accelerating the trials, but even with these, even though we've had people who agreed to have themselves tested with the vaccine, it's likely to take over a year before we have a viable vaccine. So this is still going to take a bit of time. Can you spread coronavirus by passing wind? Well, I'm pretty sure that will be a no on that question. But a little bit of a word of warning. Do remember that we know that coronavirus latches onto particular cells, particular receptors called ACE2, and these are found in the lung as well as in the vascular endothelium, the lining of the blood vessels, but also there are some ACE2 receptors in your gut. This is first of all why if you develop some gastric symptoms at the beginning of the illness, that could be the sign you're developing it. Also, it's been found that if you've got coronavirus, you go to the toilet, that some particles can actually be spread via the toilet as well. So do bear that in mind as well. However, as far as I'm aware, there's no problem with passing wind if you have got the coronavirus. So you're more than welcome to let off wind to your heart's content. So many thanks for listening to me today. I'm sorry there were some questions from other people which I didn't get a chance to answer. I will go through those next time. But in future episodes, I will talk more about some treatments as well. I'm also going to do something about health conditions in Ramadan during the coronavirus crisis. So please do like, share, comment and subscribe to my channel. And remember, please follow